Hi everyone, I'm here with Professor John Olver, who has just given an amazing talk here at ISPRM Sydney 2024 about concussion and brain injury, and we just wanted to ask a few questions after that topic. One thing I wanted to just touch on is what some of the challenges that you face when dealing with a demographic like this in your clinical practice, and how you've sort of dealt with those challenges over time.
Well, concussion is an area that's fairly new for rehabilitation in the team-based model. And again, we don't know a lot about the pathophysiology, as it's called, what actually happens in concussion, why some people get better and others don't, why they get persisting symptoms, what's the overlap between those symptoms and psychological problems. So there's just a huge learning curve. And when we started the clinic that I ran 8 years ago, it's been a huge learning curve since then. But it was interesting to me that every couple of years the world has a consensus statement on concussion. And the last one was done after the pandemic, so there was a bit of a gap. But even still, in a number of the areas, there wasn't a lot of literature that could back up and give us more information on some of the issues relating to, how symptoms progress, etc. after concussion, how you should treat them, how long you should be off sport or off work. All of these things are still slightly up in the air. So there's a huge learning curve, which actually makes it an exciting area to be in.
Absolutely. And I think another thing that you mentioned, how it's become more of a flavour topic because of all the issues with sport, especially what we've seen with the AFL and the NRL in Australia.
Yeah.
With how you look at dealing with setting up a service, because there's such an influx of people that are coming to services with symptoms, how would you recommend having a thought process behind that?
Well, I think you've got to have admission criteria, and we probably took all comers, and yet we know that we've got a lot more success with people that we see early, within the first, say, 3 or even 6 months. And after that, it's a lot more difficult, and you don't probably succeed as well in terms of reducing symptoms or actually increasing function. So having perhaps regard to the literature and looking at a triage system which matches the resources you've got to the number of people you can take. Our program, for example, is still seeing more and more patients, and we're starting to hit that wall where the waiting list is out. Now, with concussion, you really want to see the patient and start to treat them as soon as you see them, not sort of months later. So we have to make these triage decisions, unfortunately. But I think the other thing is that more people now are seeing this as a growth area and are taking it on in the rehabilitation setting.
Time for one more question. I think just in regards to going throughout the pandemic and having to try and think on your feet about how you're going to deliver a service. Did you use much virtual rehabilitation and that kind of telehealth system?
Yes, we did, certainly during the pandemic. And we found that even with physiotherapy, you could go through exercises with them on the other end, with probably a family member or something with them. The psychologist probably didn't fare as well in that area. For medical review, if I'd seen the patient first wearing full PPE, then I was quite happy to do the follow-up reviews. So yes, we did. And there's still an amount of that continuing, which is rather good.
Good. Thank you very much for your time.
Pleasure. Thank you.